Well, the Journal of Patient Safety is one of the premier peer-reviewed patient safety journals. It was one of the first, and it has published a number of very important papers on patient safety. And as an associate editor, and I've been such for, I would say, over 10 years now, I review articles, I review the reviews of articles, and am involved in the decision process of whether or not articles are publishable. Now, the editor will review, of course, my performance. The editor's David Bates, and he's excellent. But it's one of the main ways that I can contribute to patient safety. And you do it in really many ways. One is making sure, for example, the abstracts reflect the content of the journal, and it's able to get the message out by just reading the abstract of the important message in the journal. That's something that oftentimes doesn't happen. The journal article's behind the paywall and the abstract doesn't really tell you what it's about, only what it's looking at. It's not telling you the findings. Then all of a sudden, nothing much progresses. Also, I can be involved in suggesting to the authors other possibilities, other points that need to be stressed, etc. And that in itself can promote patient safety. Oftentimes, for example, an author will look at protocols and how to better improve protocols from the standpoint of the mechanism of the protocol rather than just looking at staffing. Are there staff available to even run the protocol? And so those are some of the areas that, as an associate editor, I can have an impact on. And I think that that's probably one of my more important jobs. It's more a job than an accolade. Of course, it's an honor to be an associate editor, but it comes with a lot of work too.